This session will discuss the different models for providing care and how these relate to staffing. Before we start reviewing the management of resources for staffing, let me go over the objectives. So upon completion of this session, the student should be able to develop an informed view of the current state of evidence-based care and an understanding of the role of the nurse in evidence-based decision-making. Apply steps needed to incorporate evidence-based care in practice and differentiate the characteristics of nursing care delivery models used in healthcare. Nursing care delivery model can be defined this way. It is a strategy used to provide care to patients in a variety of settings. Several considerations must be made when selecting a model. For example, you might want to provide primary nursing, but the availability of staff and the economics of it are prohibitive. Each of these factors influences the decision about delivering care. There are 5 methods or models for providing care. Note these for now. We will return to them later. There are case method, functional nursing, team nursing, primary nursing, case management. There are other strategies too. You may hear about disease management programs, patient-focused care, and differentiated practice. Several factors influence the way in which care is considered. The Magnet Recognition Program of the American Nurses Credentialing Center doesn't dictate a particular approach. Rather, it expects that the staff and the administrators can describe why whichever approach they use is the best for their situation. The Synergy model, developed by the American Association of Critical Care Nurses, is a comprehensive approach to care. It starts with a philosophical approach to care that drives the way the care is delivered. A third consideration is the clinical nurse leader, which was developed by the American Association of Colleges of Nursing. This role is new and is designed to help staff solve problems and increase the quality of care that's delivered on the clinical unit. So let's look at the main models. The first is case method. From the information you know about the case method, please answer these 2 questions. What are the advantages of the case method, and what are the disadvantages? Now let's look at the role of the nurse manager in case method. That role is to assess the patient's needs to determine level of care, and the care can be delivered by the RN or the RN supervisors the care, and hiring and management of the appropriate staff to provide the total care in a cost-effective manner. The next model here is functional nursing. It has several advantages and disadvantages. So some advantages are that it is efficient. Assistive personnel can be trained to perform specific tasks, and it is cost-effective. And the disadvantages are that care can be fragmented or task-oriented. Patients and family needs may be overlooked. There may be lapses in communication. And this model can be frustrating to the professional nurse. Team nursing, or a modification of it, is prevalent in many care settings. Team nursing has some distinct advantages. It has these attributes. It is cost-effective. Decisions are made at the grassroots level, often by staff caring for the patient, and there is improved patient satisfaction. It also has disadvantages. It needs a skilled, knowledgeable team leader. It needs adequate staff with the right mix. It is potential for fragmentation of care, and there are few work settings to implement team nursing as originally designed. Effective teams have a clearly integrated interface among these roles. Because the focus is on the team, coordination takes on great significance. Primary nursing is explained in this figure. It too has specific advantages and disadvantages, as you can see from this figure. So the advantages are going to be autonomy, motivation, holistic care, increased communication with the health team, increased patient rapport, and working with professional staff. Disadvantages are going to be very costly for the agency. The RN may not want to 24-hour responsibility, or the RN may lack experience or autonomy. Two primary hybrids exist. They are the partnership model and the patient-focused care model. Nursing case management can be defined as the process of providing comprehensive care for those with complex healthcare problems. It results in improved patient outcomes, decreased length of stay, interfaces with multiple disciplines, and care provided across the continuum of illness, often in different institutions. What populations of patients are best served by the utilization of the nurse case management model? Well, an example would be cardiac patients, those with congestive heart failure, high-risk perinatal patients, particularly those that are on home monitoring, pediatric patients, especially those with chronic illnesses such as cystic fibrosis, type 1 diabetes, and AIDS. In a case management, there will be a manager or leader of the nurse case managers. This individual will manage and lead the quality improvement process, including patient feedback surveys, making sure that the paths and the maps are current and relevant with the care practices and reimbursement methods. They will also provide oversight with case managers to be sure caseloads are appropriate and effectively managed. They will interface with other disciplines to clarify the role of the nurse case manager, and they will create opportunities for staff development, which may include individuals from other disciplines. So your text discusses critical pathways and care maps. Here are some questions to consider. How are critical pathways and care maps developed? What is the difference between the two? Why are these tools used by the nurse manager? And how is evidence-based practice incorporated into these tools? Disease management is another model that's often found in the management of a group of clients with comparable diseases. The emphasis on disease management model is that it is the emphasis on self-care or education with the goal of preventing exacerbations or complications for patients. The other major hybrid is differentiated practice. What did the text suggest as the primary differences among these roles? The nurse leader or manager performs several roles in differentiated practice situations, and these include role model, collaborator, coach, teacher, and facilitator. If you are interested in being more on the cutting edge of care delivery issues, I suggest you read about one or more of these three topics: magnet recognition, synergy model, and the clinical nurse leader. In conclusion, the role of the staff nurse is critical in each model that we discussed. Please think about these questions and try to answer them. What do you think would be what do you think it would be like to be a staff nurse in each of these models? Which model would be the best fit for you? Why? Which model is least appealing to you? Why? Remember that many organizations modify what they do, but the roots of their approach are typically found in one of the models discussed in this presentation.